babies bring a lot of joy to parents, friends, and family, but their crying can be a challenge. Babies cry a lot, especially during the first 5 months of life. In fact, a normal healthy baby may cry for a total of 2 to 3 hours each day, and babies usually cry more often in the evening. Babies will cry the most at age 2 months, but have patience. For most children, the crying will usually slow down after 3 or 4 months. Unfortunately, crying is the #1 reason babies are shaken or hurt by their caregivers. It can be helpful for parents and any caregivers to learn how to cope when the crying becomes stressful.
It is very important to never shake a baby to make the crying stop. Shaken baby syndrome is a term often used by doctors and the public to describe abusive head injuries in infants and young children. It is not caused by rocking a baby, short falls, or CPR. It is caused by violent shaking or forceful throwing by a caregiver. Inside of the skull is a very soft brain. If you make abrupt movement inside the skull, such as shaking the baby or causing their head to be hit against a hard surface, that movement can cause bleeding, swelling, or portions of the brain to tear. As a result, a child could become injured, permanently disabled, or even die. Shaking may seem less violent than hitting, but neither is appropriate.
Remember, crying is the way the baby is communicating. Babies don't cry to make anyone mad. Crying is normal. Here are some ideas that parents and caregivers can use to help soothe a crying baby. First, check to see if your baby is hungry or needs a diaper change. Call a doctor if you think your baby might be sick. Try rocking, walking, or talking with your baby, going for a ride in the car, giving your baby a warm bath, singing or playing a recorded lullaby or other soothing music. Remember, sometimes your baby will cry no matter what you do. It doesn't mean that you're a bad parent or caregiver. If the crying is too upsetting or you become too frustrated, it's perfectly okay to put the baby in a safe place and walk away. Remember to check on your baby, but if you feel angry or frustrated for whatever reason, it's best not to pick up the baby. Call someone you trust for help, such as a friend or relative. Day or night, it is far better to wake someone up than to lose control of your emotions with your baby. Make a plan for who to call when you get overwhelmed. It can help relieve some of the stress if you already know what you can do to get relief. There will be times when someone else will be caring for your baby. Family, friends, or babysitters. There are some points you should discuss with all caregivers. It's okay for babies to cry, but don't assume your caregiver knows that. Provide caregivers permission to call you anytime they become frustrated or angry. Just remember, not everyone knows how to take care of a baby, even people who are close to you. Even those who might be good with older children may not have experience with babies. Before you leave your child alone with someone, make sure they know how to keep your baby safe. It can be hard to think that someone you love or trust might shake or harm your baby, but it's good to know the symptoms to make sure your baby is safe. Some of the signs of abusive head trauma include constant crying, stiffness, sleeping more than usual, unable to wake up, seizures. If for any reason the baby has an injury, take him or her to the nearest hospital emergency room or call 911. The baby will not get better without receiving medical treatment. Parenting is very rewarding, but it can be stressful. Anytime you feel frustrated and that you may lose control, stop, place the baby in a safe place on his or her back, and walk away. Take a deep breath or call someone for support. Or if you think something is wrong, call a doctor. When dealing with stressful situations and all the other challenges of caring for an infant or child, have a plan and share your knowledge with others to keep your baby and other babies safe.